Hi, I am Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. We are excited to see the growth of all 4 JVS journals and very pleased with the new impact factor of JVS, that's now 4.268. I am happy to introduce 4 excellent papers from the 2021 November issue of the JVS. Each are freely available to read or full text download for the next 2 months. Our first article and the editor's choice for this issue is Intraoperative Consultation of Vascular Surgeons is increasing at a major American trauma center by Dr. Jake Hemingway and colleagues from Seattle, Washington. In this retrospective study of a level 1 trauma center, a 529% increase in vascular surgery consultations was seen over 15 years, with significantly increased consultations seen from trauma, 1,400% increase, and much less so by an increase in consultations from orthopedic surgery, 220% increase. Interestingly, during this period, the proportion of endovascular procedures has not changed significantly. The next article this month is titled Effects of Supervised Exercise Therapy on Blood Pressure and Heart Rate During Exercise and Associations with Improved Walking Performance in Peripheral Artery Disease, results of a randomized clinical trial. This was written by Dr. Joshua Slice and colleagues from Chicago, Illinois and Palo Alto, California. This is a post hoc analysis of the PROPEL randomized clinical trial, where 210 people with peripheral artery disease were randomized to supervised exercise therapy or a control, no supervised exercise therapy group. 6 months of SET, S-E-T, decreased the mean systolic blood pressure by 12 millimeters of mercury, pulse pressure by 9 millimeters of mercury, and heart rate by 7 beats per minute during a graded treadmill exercise test compared with the control group, and these changes were statistically significant. Our CME article this month was written by Dr. Jake Hemingway and colleagues from Seattle, Washington, Honolulu, Hawaii, and Pathum Thani, Thailand. It is entitled Preoperative Risk Score Accuracy Confirmed in a Modern Ruptured Abdominal Aortic Aneurysm Experience. In this single-center prospective study of 118 patients with ruptured abdominal aortic aneurysm, the HarborView risk score, a 4-point preoperative risk scoring tool, was used to predict 30-day mortality after treatment. This tool assigns 1 point for each of 4 preoperative variables when present: age greater than 76 years, pH less than 7.2, creatinine greater than 2.2 milligram per deciliter, and any episode of hypotension, defined as systolic blood pressure less than 70 millimeters of mercury. 30-day mortality was 14.6% for a score of 0, 35.7% for a score of 1, 68.4% for a score of 2, and 100% for the scores of 3 and 4. This scoring system appears to accurately predict 30-day mortality from ruptured abdominal aortic aneurysm based just on 4 preoperative variables. The final article this month by Dr. Michael Dake and co-authors from Tucson, Arizona, Palo Alto, California, Philadelphia and Pittsburgh, Pennsylvania, Rochester, Minnesota, Lebanon, New Hampshire, and Madison and Ann Arbor, Wisconsin, is entitled Evaluation of the GoreTissue Thoracic Branch Endoprosthesis in the Treatment of Proximal Descending Thoracic Aortic Aneurysms. In this multi-center prospective feasibility study, 31 patients with proximal descending aortic aneurysms had undergone successful implantation of a single-side branch endograft. Preliminary result at 1 month included a side branch patency of 100% and freedom from endoleaks, type 1 and 3 of 96.7%. There was no 30-day death or permanent paraplegia. Through 1 year, 5 patients had died. However, none of the deaths were related to this investigational device. These were just 4 of the many excellent papers we published in the November issue of the Journal of Vascular Surgery. Please read our journals, follow us on social media, and send us great manuscripts for publication. Thank you for watching, and see you next time for the highlights of the December issue of the Journal of Vascular Surgery.